everyone. The Indian Medical Association of Queensland has been running a public health lecture series since March 2020. Our members, who are doctors of Indian origin and practice in this wonderful state of Queensland, they volunteered their valuable time and expertise in this endeavour. The advice given by any doctor is of general nature and meant for information and education only. Please note, this is no substitute for your own healthcare professional, and everyone is advised to consult with their own treating physician for ongoing health issues. I will now ask the Secretary-General of IMAQ Queensland, Dr. Cyril Fernandez, to introduce to you our guest speaker of this month.
Hello listeners, welcome to another episode of Aap Ki Sehat, meaning your health program of the Indian Medical Association of Queensland. Remy has already briefed you on the public health message from the Indian Medical Association. Today we have the talking and listening pleasure of Dr. Feroze again on continuation of the previous episode. Dr. Feroze, welcome back.
Thank you, Dr. Cyril.
Yeah, I know that you come from Kerala, south of India, yes. God's own country, and you have traveled to the Middle East, worked there in United Kingdom and now in Australia, working as a general practitioner, fellow of the Royal Australian College of General Practitioners, special interest in aviation medicine for CASA, and a practice owner as well. So a lot of responsibilities, a lot of community things. General practice, as we know, is the cornerstone of healthcare. So can you please highlight or start giving the viewers something on general practice again, and then move on to what your area of specialization or special interest in general practice is, Dr. Feroze?
Okay, thank you, Dr. Cyril. As you know, in general practice, we see a variety of patients and conditions. And in Australia, actually has a very good system where anyone from a child to an adult or to an old person, they all can access Medicare subsidized treatments, and they can come and see the GP for preventive health, to illnesses, to managing illnesses, as well as social and mental conditions as well. So Australia has a very good system where a GP actually is the center of care for a person. And this actually it's quite a privilege in this world, because
and we know that general practice involves from hair to toenail medicine, you know, so cover all aspects of the mental and physical side of things, health checks, 45, 49-year-old checks. And do you do any pre-medical checks like driver's medical?
Yes, so we do occupational health. Part of that is checking for people for pre-employment if they are ready to a certain type of work. And then we do commercial driving license medicals, which is, again, you know, if you're driving, commercial trucks and buses and carrying passengers or large amount of cargo, you need to be cleared medically. So depending on, we do that. Even it's also mandatory over 75 in Queensland, especially, that people over 75 needs to have a driver's medical done as well. So yes, we do that as well.
So you check their memory and...
Yeah. So just to see how fit they are to drive, you know, and if they are safe on the road.
Can you highlight more about the CASA aviation medicals that you have a special interest in?
Yes, so aviation medicine is obviously, again, it's a part of occupational health. So anyone who wants to fly will actually can get a live medical is one part of that. So if they complete the medical and then they can actually progress with their training before there are different levels of medicals they need to do. One is class 1, class 2 and class 3. So if you're a commercial pilot, then you're supposed to have a class 1 medical. And if you're doing a private, if you're a private pilot, you can fly with a class 2 medical.
So class 3 is what, air traffic controllers?
So class 3 goes to air traffic controllers or drone operators and things like that.
Being a practice owner, what challenges do you face, or is it easy to run a practice?
Well, everything is there are good and bad in in everything you do. There are days which is quite rewarding. There are days which will be very difficult. So it is always interesting, I would say.
What are your hobbies? What do you do in extra time? May I ask you, Dr. Feroze?
Okay, so to keep my balance, I have to do certain things which I enjoy. So I do enjoy driving, four-wheel driving in the remote part of Australia, especially with my friends. I do a little bit of motorbike riding. I play music. I listen to a lot of music. So
That's good being a busy GP is finding time for all these things.
yes.
Remia did ask you a question on take-home messages for a healthy lifestyle. So do you want to highlight to the viewers on how to have a well-being, healthy lifestyle strategy?
It's important to listen to certain cues your body is giving. If you suffer from, if you're feeling unwell, if you're not sleeping well, if you have low mood, it's important that you see your GP and have a chat with them to see what's going on. At the same time, if you have family history of any certain conditions, talk to your GP about it and have a plan how to screen it early on, and that'll actually do a lot of good to you.
So that's good. And then you would emphasize on the immunizations, COVID vaccines. Your practice is giving those things as well?
Yes. Yeah, like in all, most practices are providing COVID vaccinations now. I think that's the way how the future will go, so that Australia can open up for international travelers and families to rejoin. We cannot keep the bubble in this way, how we are doing it now. So I think if more than 50% of the population is vaccinated, there will be more international travel and people will be able to travel a little bit more freer.
As a GP, you cater to different age groups, chronic diseases, complex issues, pain management, and towards aged care and things. We may summarize and wind up here with anything you want to tell the viewers more about your general practice in brief.
I think that maintaining a balanced lifestyle is really the key here.
Smoking, alcohol.
So staying away from smoking, drinking very minimal amount of alcohol, having a healthy diet, having regular exercise, and lead a stress-free life.
It is very good information. Viewers, on behalf of the Indian Medical Association, I extend a wholehearted thankfulness, gratefulness to Dr. Feroze for finding time to come here and give us this health talk, Aap Ki Sehat program. Thank you so much.
Thank you so much.
And thank you very much to Dr. Feroze Fernandez there as well, and all the members of IMAQ. And it is wonderful to get that monthly program on very, very topical issues surrounding us. So, ladies and gentlemen, that has been the March episode of Aap Ki Sehat. We will see you all in the next episode. Until then, it's goodbye from us.